All right. All right. Well, thank you everybody for jumping on and attending this virtual educational program. My name is Chad Plontz. I'm with Edward Jones. Actually, I have an office right here in Bowling Green, 519 West Booster, right around the corner from the Senior Center. We put on these educational programs quarterly here at the Senior Center. Today, we're going to be talking about healthcare and your retirement. So hopefully you can see on the big screen here, we'll be going through some slides. We have a special guest with us today, Lance Wood with State Farm, who's also here in Bowling Green, and he'll have an opportunity to introduce himself to you here in a moment. Just want to kind of take you through a couple of different things, though. Obviously, we're going to be talking about healthcare and your retirement today. But I wanted to take you a little bit through the process of, what I do with Edward Jones and how I help my clients through our established process. And that's really first things first is evaluating where you're at today, understanding your current situation. And then from there, really figuring out tangible goals, right? Measurable goals, things that you're trying to achieve. And then from there, between knowing where you're at currently and what your goals are for the future, allowing us to, build a strategy to say, okay, are you currently on track and are your goals realistic based on where you're at today? Only then can we, build a, tailored strategy for your situation to, help you achieve your goals. And of course, staying on track, life happens from year to year. So we stay on track and talk throughout the year to make sure that we're staying on track to reach those goals that we've set up. And it's no different when it comes to healthcare and your retirement. So whether or not you're somebody that's, not really given much thought to the healthcare portion when it comes to, living in retirement. So if you haven't done that yet, or you think you're in a good position, but would really like to just make sure that you're still on track and that nothing has changed if it's something you set up, some time back. Hopefully this program will give you a little bit of information. The main areas that we'll be talking about today, first off, Lance will be jumping in and he'll introduce himself and give you a little bit of background about himself and how he helps his clients, but he'll be kind of taking over and telling us about Medicare and some different details to know about Medicare and things to consider. From there, I will jump back into the conversation and kind of help out with long-term care. Some of the things to think about when it comes to your retirement strategy and how those different healthcare costs can really come into the, reaching the goals of retirement and living in retirement. So once again, the two areas we'll be talking about: traditional medical expenses with a lot of times Medicare, right? Doctor care, prescriptions, dental, those types of things. And then once again, back to the long-term care aspect of it, assisted living, adult daycare, nursing home care. So once again, I'll hand it over to Lance here. He can kind of introduce himself and tell you a little bit about what he does.
Sure. So my name is Lance Wood. We own actually two offices, one in Bowling Green and one in Fostoria. State Farm agencies are right in front of the Wood County Mall. So right here locally, and then on Main Street in Fostoria as well. So kind of give you an overview. So the Medicare process can be very confusing. I'm sure most of you that are in this meeting or watching this have gotten that book. It can be a very cumbersome book, a little bit overwhelming to have that. There are a whole bunch of different options when it comes to Medicare, but the generic Medicare process is there's Part A, there's Part B, there's Part C is what I call it, and there's Part D. A little bit different than what the slides show here, but Part A is going to be hospital, so all hospital stuff. When it comes to Part B, it's mainly doctor visits, those types of things. Those are automatically standard. Part A is normally free if you have a number of working years. Part B, Part A is automatic at 65, automatic even if you're still working. Part B is enrolled in either when you're 65 or when you retire, depending on what day that is, and you enroll in that. You have a free open enrollment period to enroll in what covers Part C. So Medicare covers an underlying 80%. You are responsible for 20%. Okay. So that big book you get is to give you 1,000 different options of different ways to cover your 20%. There's two ways you can do that. It is either a Medigap, which shows on the screen here. Another word for it is a supplement, or a Medicare Advantage plan, most of which is in that book is what they call a Medicare Advantage plan. Medicare Advantage is marketplace-based, which means every single year you're going to go through an open enrollment. Premiums can change, coverages can change. You typically have deductibles, you typically have co-payments depending on what you choose. There is no requirement on qualification for that, and there's no health checks. For a supplement, you do have those. If you enroll it 3 months before or 3 months after you turn 65, or when you retire or enroll in Part B, let's say it that way. So if you retire at 70 and you enroll in Part B, you have that time frame. So there is no health check or any qualification on a supplement. After that point, there is going to be. Supplements cover typically 100% of most everything of that 20%, except for prescriptions. The highest plan you can have right now is what they call Plan G, and that one covers everything except for your Part B deductible. So Part B, when you enroll in that, one more clarification on that, you will have a premium. It's set in stone across the board. It's the same for everybody. Again, Part A is free if you have a number of working years, which most people do. So when it comes down to, one more thing I want to clarify on that, Part A, the only way you'd ever have to pay for Part A is if you were a stay-at-home mom and are not, if your spouse, once they qualify for Medicare age, it's automatically covered for free for you as well, just so you know that, okay? So again, it's either supplements or it's Advantage plans. Advantage plans can be less expensive. They're better than nothing. There are quirks to both those things, but we kind of go those later. But supplement is typically an all-encompassing coverage. The coverages never change on that. It is not open enrollment. It's set in stone. Last thing is Part D. So Part D is your prescription. That is always marketplace, so marketplace based. Advantage plans have prescription drugs rolled into that plan. Supplements do not. Okay, so with a supplement, we have to outsource, which we help offer those things as well. And we run a list of all your prescriptions. When I say all, fewer is better, but it doesn't matter how many there are. We can run them through our system, and we can tell you exactly based on cost associated with that, what plan is the best cost, most cost effective for you. We also will look at GoodRx. So there's also free programs that we will look at to make sure that we can tell you what a prescription cost would cost through insurance and vice versa through the GoodRx card. Because sometimes it's less on GoodRx, so we can tell you that. So there's two systems that we run in our office that associate with that. So I will turn it back over to Chad.
Well, and so that's some good information, Lance, and actually a couple different things that I thought we might want to expand upon a little bit. First, those important dates to know, right? You'd mentioned that there's enrollment periods, maybe for those that are on that, are maybe a couple of years away, but aren't exactly sure. They haven't received that big book in the mail yet, right? So maybe just to be able to explain a little bit about those important dates and why are they important, right? What happens if we miss those dates?
Sure. You don't want to miss those dates.
That's perfect.
Let's not discuss why. So recommended enrollment is 3 months prior to 65. You have 3 months before, 3 months after. So you got a full 6-month period of time where there's no health checks involved for a supplement, as well as obviously they call that a kind of special enrollment, but it's initial enrollment, which means your first enrollment into Medicare. Okay. So that's the first thing, 3 months before, 3 months after. The reason this slide is saying to do it 3 months before is because of the fact that the last thing you want to do is wait and not have it covered on it. Typically, it's a 30-day wait period when you enroll in that. So you want to make sure you at least give it some time to activate on the exact day you want. So I typically say at minimum a month before you need it. So answer some other questions on dates and stuff like that as well. Again, to make sure we're clear on this, for any of the Medicare Advantage and or supplements, the dates time frame starts when it comes down to when you enroll in Part B. So again, Part A is automatic when you're 65, no matter if you're working or retired. Part B is when you call the Medicare office and say, I would like to enroll in my Part B. That's when the time clock starts ticking. So usually that's retirement. If you are retired, then it's automatically at 65. You're going to be enrolled in that, or what you call. So if you have qualifying, reason I'm saying that is if you're working and you have qualified health insurance, you can hold that until you desire to go into Part B. But you can enroll in Part B even while employed. If you want to, you don't have to. It just depends on a lot of cases. It works out to be less expensive to do that than it does to pay for the major medical through the employer. So age 65 and older are not enrolled. Age 65 and older are not enrolled. You need to be aware of time frames. So we talked about that. You may enroll during a special enrollment period. So let me clarify this. So special enrollment period is typically we'll make this very short, sweet, simple. So once you go through your initial enrollment, let's say you move to a different location, a different county, a different zip code. Most of the time it's different county, different state. That sends you into what they call an open enrollment period. which means you can change that mid-year to a different Advantage plan, to a different prescription plan, those types of things. The other really neat thing about a special enrollment is, let's say we go with a basic prescription drug plan, which we can kind of give you every option there is out there. And for some reason, we added, the doctor adds an additional prescription, and that prescription is covered differently on that plan. That also sends you into a special enrollment, which means we can change the prescription drug plan to a plan that's going to be covering that specific prescription, so you're not having to pay a higher cost for that prescription. So it gives you a lot of flexibility in making sure that we're cutting costs in every area we possibly can. So, Chad,
All right, perfect. And the slides that we have here just talk about some, maybe estimated costs associated with it. Maybe you're seeing changes to this. Granted, these things are ever changing, right? So now, and from my knowledge, income plays into it, correct?
Correct.
So maybe you can just touch upon
Sure.
that, where maybe that's an important strategy for the retirement picture, though,
Very
right?
important.
Of saying, if you're still planning for retirement, even more reason to have multiple buckets of income, right?
Sure.
You don't want everything tax deferred where it's going to be considered taxable income when you're pulling out retirement, because it doesn't only affect the taxes you pay, but also affects the
Sure.
taxes on Social Security. It can affect your premiums when it comes to Medicare, right? Depending on how much you're spending. So don't know if there's anything you want to really
Yeah.
dive into in terms of just estimated costs and things along
Sure.
those lines.
So Part A, the reason it's showing cost of plan, for those, I hope you guys can read that, see that in here, but Part A, the reason they're budgeting 0 on that is, again, if there's a number of working years that you have in, which 90% of people do, the Part A is automatically enrolled, it's paid for, based on how long you paid to Social Security and paid taxes and stuff. So the only outlier that I really have on that is, again, most important job in the world, somebody that a stay-at-home mom doesn't have a certain number of years, but most of the time it's like, it could be 10 years. It's not anything crazy. So 99% of people qualify for that for free, or they qualify underneath a spouse once they qualify for Medicare age, which is 65. And it's not like Social Security. So early Social Security pulls 62, Medicare is 65 no matter what, unless it's disability or something, you can get shoved into it early on that. Or that's the only really outlier to that. When it comes down to Part A, the other outlier to clarify is those that are on STRS, governmental jobs. They don't really pay into Social Security, state organizations. So that is a different ballgame. I work with STRS all the time and that kind of stuff. So that's a conversation for another day. I'd be happy to, if any of you guys have any questions on that. It just comes out of Social Security. So Part B, that's an average cost. That Part B's premium changes. You're right. There's different credits based on income. It's all over the board. The average is still about $2,000 a year or something like that. That usually automatically, or let me say differently, it always comes out of Social Security before you get your payments. That's why you're typically not going to see that, but they issue your Social Security payment after that's paid. In the event of being STRS or not having paid in Social Security because you're paying it for comp or a state organization, then the clarification is that would come out of your checking account. So, which again, it's the only really difference there. Part D, that ranges as well. So it really depends on if you have a Medicare Advantage plan or if you have a supplement. So having a standalone prescription plan, you're looking at approximately, right around, I would say $20 a month to the highest being $50-$60 a month. So 500 might be a little bit high there on average on that. With a Medicare Advantage, it's usually rolled into there. It's more like a major medical plan that we're used to outside of Medicare. Supplemental averages on that can be anywhere from $180 a month to later in age, maybe $150, $200 a month, something like that. So those are very good averages there on that. So the annual costs are budgeting on that between 45 and 65. Most often, Medicare saves a heck of a lot of money comparable to being on major medical, just to make sure we're on the same page on that. One thing before I forget on this too, do not wait on doing a prescription plan. That's one thing I've had clients that have asked me the question of, well, I don't have any prescriptions right now, or I don't have any issues right now. I don't mean the word issues. I don't have any health concerns. Why would I pay 20 or 30 or $40 a month for something I don't really need to use right now? Here's the reason. If you don't do that, every day of coverage you don't have you will pay a permanent penalty increase when you do enrollment. So if you wait 2-3 years, that penalty can double the premium at minimum. And you're paying that. There's no way of eliminating that. There's no way of avoiding that. So you always want to make sure when you either are 65 or when you enroll in Part B at retirement or whatever that age may be, at that particular time, you want to make sure you have either an Advantage plan encompassing prescription drugs or a supplement, Medigap, same thing, with a prescription plan enrolled at that time. Don't ever miss one of those parts, which is what we talk about all the time, because it does lead to penalties that are not able to be removed. And those are governmental penalties. So anyway, I'm going to pass it back over to Chapter.
Yeah, that's a great point, right? Not missing out on that enrollment of those options. You know, you can think of it much like life insurance premiums, right? The later you wait, yes, those are, I mean, I guess you could classify them as penalties, right?
Yeah.
If you don't set up something for life insurance or a long-term care insurance earlier on, you're going to pay for it in premium. You know, you save those years, but when you go to actually take advantage of it, it's they're going to end up, they're going to charging you for it. So, so that's a great point, which kind of transitions us over to the next part of the conversation. And that's really stemming along long-term care, and when we think of long-term care, you know, that's kind of a broad phrase. What we really need to be talking about is what is long-term care, right? It's nursing home care, it's assisted living, home health care, adult daycare. So, and you know, the cost for each of these areas, depending on the need, is different. And for those, you know, this, you know, I'm going to show a screen here, but it's not good. You know, it's definitely a smaller version here. So let me, definitely not going to be as easy to see. So what I'll tell you is that you can actually, if you go to your computer and you jump on Google, you can actually type in cost of care. If you type in cost of care, one of the first links that'll come up in that search is going to be this website through Genworth. And this is a nice tool to say, okay, because this is going to be hard to read with the print being so small, but you can literally put in your zip code and it's going to tell you the averages. So if I put in 43402 for Bowling Green, it's going to say, okay, well, for the Northwest Ohio, the Toledo, Ohio area, what are the average costs for different types of care? Whether or not it's in-home care, right? If something were to happen and you just needed in-home care, or if you needed community or even assisted living, what are those averages in the area as of this year? Nursing home facility, right? The more care you need, obviously that's going to, you know, generate more cost. And keep in mind, these are averages. So, you know, when we talk about nursing home facilities, which would definitely be on the higher end, it's more skilled, there's more needs that are met there. You know, in today's dollars, you could be looking at, on average, almost $8,000 a month in expenses. So, you know, this website's nice to say, okay, well, where are the averages at today? But you can also, there's a nice calculator here that can kind of help you figure out what inflation is going to do to these costs, right? Yeah, we may be healthy today. We may be thinking about long-term care needs in the future because maybe there's, you know, family history of long-term care, and that's a concern of yours. If it is, and if it's something you want to plan for, we can say, well, hey, you know, I'm 65. What's the reality that, you know, I'm going to need long-term care today if I'm 65? Well, you know, your odds are lower, right? But that doesn't mean you shouldn't be planning for it today. And then we can calculate, okay, well, if we're 10 years out, inflation is going to account for that. Instead of $8,000 for a nursing home today, it could be $10,000, $11,000 a month 10 years from now, right? Just based on inflation. So, you know, this is a nice website if you're wondering, hey, what, you know, realistically, if I'm going to start planning for it, what do I need to be worried about in terms of costs and different types of care that are associated? So once again, jump on Google, go to cost of care or type in cost of care. Genworth is a nice website. I'm sure there's probably others out there that you can do this on. It's the one that I tend to use the most. So let me go back to this. So our slideshow, once again here, you know, we talked a little bit about the different costs. So when it comes to the plan, I mentioned kind of when we started this whole program off is that it really comes down to where are we at today, right? Are we still gearing up for retirement? Maybe we're about to retire in the next few years, or maybe it's a scenario where we're already retired. Well, have we ever really put a plan in place for long-term care? Is it a concern? Is it a goal of yours to pay for long-term care, right? So obviously the variable is nobody knows if we're going to need expenses for long-term care, right? So that's a part of it. But just like any type of insurance, right? You have two main areas. So in terms of long-term care, people that are age 65 and older, 1 out of 3 people that are 65 and older end up having some sort of long-term care need in their lifetime. Now that doesn't mean it's for a long period of time. Sometimes it's a year or less. The average long-term care need statistically at this point in time is right around 28 months. So call it 2.5 years is the average long-term care stay for somebody that's over 65. And those averages, most people hit that long-term care need, late 70s, early 80s is statistically the most, realistic age, right, is when you're going to be using those. But you'll find, as the conversation was about premiums, right? If you're hoping to insure past that risk onto an insurance company, if you wait until you're, in your mid 70s, late 70s, that's when you're going to be saying, okay, am I even insured? Concern of yours. So, are you going to save for it, or have you been saving for it, or do you need to start figuring that out? Or basically, are you self-insuring, right? Are you going to figure out a way to pay for this based on or what you're going to continue to save? Or are you going to insure against it and pass that risk on to an insurance company?
And let me throw in one thing on this.
For sure.
So something else that Chad offers too when it comes to long-term care policies in general, some people will say, well, why would I start this when I'm in my 30s or 40s or 50s for your maybe grandchildren, maybe your children, maybe you, if you're watching this. So the clarification would be is somebody will say, well, I'm paying this for 30 years, 40, 50 years before I actually need it. So, so you do the math on what the higher premium would be in your later age. Two concerns with that is, though. Later age, you're right, insurability. But secondly, when you're young, as in, I think it's 35, if I'm not mistaken, qualify that age, I thought it used to be with us. To start putting it into a long-term care policy is they have policies that you can start with a lower daily benefit and they will increase by 3% every single year. So which means you're not paying for a $400, $500, $600 a day benefit. You're paying for a $150 a day benefit, which is very inexpensive. And that policy builds and grows over that 30-year period of time. Do the math on that, how much you'll have in it and how much you'll have starting at 60, you probably have half. So it does work out financially to start earlier with the right type of policy.
Was like kind of a standalone product, right? Where how a lot of actual details we can get into, and everybody's situation is different. And this is why you want to meet with somebody and really get a plan in place. Because the spend down when it comes to, hey, what assets do I have
dollars of liquid assets. That's
Yeah.
so people say minimum. What's the minimum? It's literally $2,000.
Yeah.
So it's extremely restrictive.
And
And
they,
Medicare care, I mean, well, my grandfather, one of the reasons I'm in this business is because of the fact of my grandfather was on Medicaid. My grandmother had long-term care or had a long-term care policy that was unlimited, which I don't, those are hard to find now.
Yeah.
That was years and years and years ago, a long time ago. Her experience in a facility was pretty much like living at Great Wolf Lodge. It was unbelievable.
Yeah.
My grandfather, and we're going in there, he had Alzheimer's, crazy screen, lived with it for 15 years, and I watched him live on a wing. There's nothing against that, but the Medicaid care is totally different. They had 2 nurses for an entire wing of probably 20, 25 patients. So the lack of one-on-one attention with him, you go in there and he would be uncomfortably soiled, and there was times where it's just the difference between that and 2 nurses for 5 rooms is a whole different animal. So, and Medicaid's doing what they can with that.
sure.
But it also put my grandmother in a very, very awkward situation where there was really no, and they also, if you have life insurance and Medicaid has to get involved and it's permanent life insurance, they will make you cash those out.
Yes.
So you don't have a backup plan income wise for your spouse. If Medicaid has to get involved, they will cash those things out. So even more of a reason to make sure, and self-insuring is a challenge. You get to retirement though, and you're trying to self-insure yourself, what are you doing again? You're limiting what you have the ability to draw income.
Yeah.
Now you're trying to budget yourself. Well, I can't spend this for the long-term care policy. Spend what you have.
Yeah.
Spend what you have.
Yeah. Absolutely. And everybody's situation is different. And great plug for a Great Wolf Lodge.
Yeah. Well.
So
It was just a beautiful, it's a totally different experience with Medicaid comparable to having a long-term care policy.
absolutely. And so once again, you have the opportunity to self-insure. Is that right for you? Everybody's situation is different. Obviously, that's something you would want to sit down and look at your plan. Obviously, the traditional long-term care, which we've kind of hit on at this point, and the idea behind that traditional long-term care is it's going to pay for long-term care. There's no death benefit or anything along those lines, to leave as a legacy or to a beneficiary if that long-term care is not necessarily used, right?
Sure.
So there are other products now that are available. And I'll just keep this very high level just to give you some information that says, hey, products would be less. Your assets, and then, you had this life insurance policy and it'll pay out your beneficiaries, but you never really were able to access it or allow it to provide additional benefit to you while you're here. So once again, those are, and that's typically of the 3. Of course, there's the self-insure, there's the long-term care, there's the hybrid products, and then there's your standard life insurance with a rider that allows you to spend down your death benefit. That last option is typically the most cost-effective way of trying to do this in terms of a premium. So if you're wondering just, hey, are they all super expensive? I can't afford these types of things. There's options available, I guess is what I'm getting at. So yeah, that's kind of really the idea. And the reason I wanted to bring Lance in here today is because a lot of times this takes a team, right? It's great to have additional professionals in the area that I can lean on. insurance person. Where we can help build a team around you. If it's not something that you already have in place, that's what we're here for, is a reference to be able to put you in the best position possible, and to bring professionals in to help you in all those different areas. So anything you want to add to that at all?
Yeah, it just when it goes through knowing what a will does, knowing what has to be in a will, knowing what does not have to be in a will. We typically talk about, we're not an attorney by any means, but
Sure.
Same thing, we have an attorney that we work with.
Yeah.
Sure, probably the same one you do, but clarification is just a matter of, and also knowing trusts, if there's any trusts, revocable trust, irrevocable trust, best way to handle taxes, all those things are extremely imperative to analyzing your strategy during retirement, and also your strategy of how to build assets if you're young and building those assets.
Absolutely. Absolutely. So, you know, once again, this is a lot of information, very high level at this point. But we wanted to just kind of give you some starting points, things to think on. Obviously, with Lance and I, we're here locally. We'd love to help sit down with you and really figure out, you know, where are you at today and what needs do you have. So we're here to help. We'll leave information, obviously, with Danielle Brogley here, who's in charge of the programs here at the Senior Center. Feel free to reach out to her. In the future, of course, we do these types of educational programs quarterly. We've done Social Security. That was our last one. Obviously, the healthcare portion of it today. We'd love to hear your guys' feedback on, you know, what are some of the things that are on your mind? What concerns do you have about your current situation? What educational programs could provide some value to you? So we'd love to hear about that information. But as of today, obviously, we don't have a question and answer available here, but Lance, if you want to just let people know how they can maybe get in touch with you.
Yeah, feel free to. I mean, obviously, the goal of these things is to build up questions or to answer direct questions from you guys. So I would feel free to email me, call us. So visit us. We're 1180 North Main Street, right here in Bowling Green. Our phone number is 419-352-9476. If you want to email me, it's just lance@myagentlance.com.
Perfect. And once again, my name is Chad Plontz. I'm with Edward Jones, right around the corner from the Senior Center here, 519 West Wooster. Our phone number, if you want to reach out and maybe ask a couple questions or even schedule a time to get together, that's 419-353-0887. Appreciate everybody's time.
Nowadays, and that one-on-one attention that we provide. I mean, I know Edward Jones has virtual